Hello, I'm Dr. Richard Vautrey and I'm a GP in Leeds and I'm the chair of the BMA's GP committee. Just a few months ago, it would have been hard to imagine how something we had never heard of before could have had such a dramatic impact so quickly on the lives of so many people across the world. And yet that has been the devastating experience as the new coronavirus rapidly spread across continents and changed the lives of billions of people. Let me just briefly reflect on how the pandemic has radically changed the way that general practice operates and the impact that it's had on our staff and patients, not just during this crisis, but perhaps making changes that will be much longer lasting. As the potential scale of the impact became apparent, health systems rapidly changed to prepare to respond to the crisis, and general practice in the UK did just that. Within days, practices radically changed the way that they delivered care to their patients, moving to a total triage arrangement, which means speaking to everyone briefly as quickly as possible before deciding how best to meet that individual's need, carrying out consultations predominantly by telephone, and increasingly using video technology, as well as other digital support tools to provide advice and guidance to our patients. All of this was done to reduce face-to-face consultations in the surgery or home visits to a minimum, and so protecting healthcare workers and patients alike from catching the infection. Whilst most practices already offered telephone consultations, and patients were familiar with this as a way of engaging with their practice, video consultations were much less commonly used. For those practices that had access to video technology to facilitate remote consultations, this has been very helpful over the last few months. Telephone consultations are a useful way of consulting, but it's often been vital to be able to see and examine patients and to have a safe and accessible system, which can be relatively easily used by patients as well as practitioners, has been invaluable. Patients have also increasingly emailed pictures to support diagnosis, and practices have had to develop systems to ensure that this was done with the appropriate safeguards in place, particularly if it related to lesions or rashes in intimate areas of the body. Updated national guidance has helped with this. However, despite the large-scale move to remote consulting, it was still necessary at times to see a patient for a physical examination or to carry out a procedure such as a blood test or an immunisation. The availability of adequate PPE was a major issue throughout the early months of the pandemic, with many practitioners not feeling that they were properly protected, particularly as they saw the large number of healthcare workers who contracted and died from COVID-19 increasing. In general practice, we were not used to wearing PPE, but now needed to do so for every face-to-face consultation. And obtaining sufficient supplies has been challenging. All too often, as national supplies were inadequate, practices were supported by local schools, businesses, or individuals who donated face masks or visors. It was also clear early on in the pandemic that some people were at an increased risk of COVID-19, not least older people, those from Black, Asian, minority ethnic background, or those with other healthcare conditions. The deaths of so many BME healthcare workers, including GPs, has been truly shocking. Practices needed to do risk assessments of their staff and then take steps to mitigate these risks, including enable them to focus on remote consultations or to work remotely from home. Increased availability of laptops or internet connections has helped facilitate this. The use of home working has also been necessary to enable greater social distancing in office areas within surgeries. The early period of the pandemic saw a dramatic fall in the number of patients contacting surgeries as they understood the pressures that we and the rest of the NHS were under. However, it was far from a quiet time as we spent many hours in long days trying to change the way that we worked and put in place systems that will be needed for the months ahead. This included contacting large numbers of our patients who were identified as being at the highest risk from COVID-19 and were being advised to shield from the infection by staying at home and significantly limiting their contact with others. This was often a difficult task, as the list of people who should be provided with this advice kept changing and dramatically increased in number to almost 2 million altogether. However, contacts from patients have increased again, and the workload pressures we were familiar with prior to the pandemic are returning. Many people who delayed speaking to us about their problem now needed referral, but many hospital systems have struggled to put in place safe arrangements to be able to deal with a significant backlog of cases. The reduction in capacity and capability will have a major impact for the foreseeable future, with longer waiting lists and delays in getting the necessary treatments. And whilst most patients understand and accept this and understand the reason for the delays, this is going to have an impact on their mental health and well-being for many months ahead. And we will all have a role in supporting these people in this situation. Moreover, practitioners worry that delays in diagnosis or treatment could lead to longer-term consequences for many of their patients. We've also seen throughout this period the impact on our patients' mental health. Many have struggled with the psychological impacts of social isolation, worries about work, the challenges of working from home, or the pressure to return to work when they believed it was not yet safe to do so. Above all, the fear about the infection and the impact it was having on family and friends has been hard for many to cope with. This will undoubtedly continue to place pressure on all of us as we try and support people as best as we can in the months ahead. We will shortly have the major challenge of delivering the annual influenza campaign, but this will be far harder than normal as we try to protect as many people as possible, but also deliver a service to large numbers of people with social distancing arrangements in place. The last thing anyone wants is a serious outbreak of influenza on top of the coronavirus pandemic. So this is something we must prioritise. The pandemic has been a challenge for us all, but the different ways of working has led many to feel that they've been freer to focus on the needs of their patients and felt less burdened by the usual NHS bureaucracy we normally have to contend with. A BMA survey with over 2,500 GPs responding found that 55% felt less burdened by bureaucracy and 66% of GPs had felt a greater sense of team working. 82% called for less paperwork and bureaucracy to deal with in the future, and 88% expected to be using remote consultations to a far greater extent in the long term. The impact of COVID-19 will remain with us for many years. This will particularly be the case for the growing numbers of patients who are struggling with the impact of contracting the infection and who are left with a long-term illness, with tiredness, muscle pains, breathlessness, depression and anxiety. Practices and patients will undoubtedly use remote consultation methods to a greater extent in the future. But we must also be mindful of the risk of widening health inequalities and of supporting those who don't have access to broadband or computers or smartphones. We must not allow this to widen health inequalities and make it harder for some patients, some of whom need us more than many, to get access to healthcare. Should an effective vaccination become available, it will be necessary to hopefully change the balance and get the pendulum to swing back to return to a greater proportion of face-to-face consultations in the future. Because general practice is based on human interaction and the strength of long-term relationships between clinician and patient, and that's done best when done face-to-face. Throughout this challenging and difficult period, general practice has rapidly changed and adapted to both protect patients and our workforce. But a constant throughout this has been our first concern, which has been for our patients. We may no longer, and for the foreseeable future, have a waiting room full of people, as chairs have been spread out or even removed altogether. But we have the same people to care for, the same people to support, the same people to be alongside in their times of need. We will continue to do what we can for them to the best of our ability, for it is and remains our calling.